Uh, Hello, everyone. I'd like to welcome you to another live webinar organized by I Love Homeopathy and Sahya, the School of Artistic Homeopathy for Youngsters and Adults. Sahya is maybe one of the, or maybe the only organization in India or in the world now which actually mentors young homeopaths and more experienced homeopaths. They have over 4,000 people. They are in their Facebook uh, group, and they conduct online and meets every now and then for them to upgrade their knowledge. This was started by Dr. S.G. Biju, and we have with us one of the most active speakers at Sahya. He actually coaches youngsters and adults there. His name is Dr. Rakil Shanta Shaji. Uh, Although he looks he is a young guy, but he's got a lot of experience. And I welcome him to this live webinar. Dr. Shanta, Dr. Akil, please.
Thank you. So we can start.
Yeah.
Good evening, all. Is this full screen, right?
Yes, it is. It is.
Okay. Okay. Good evening, dear doctors. It's a pleasure to talk with young and all senior doctors in this beautiful evening. I hope everyone is safe in their home and also have started their clinics as usual. So today we are going to deal with one of the most important topics and the most conventional and the modern system where they most of the patients go for the treatment like thyroid and infertility. So what we are going to discuss today is the second most important and the most people who depend for treatment in homeopathy as well as in modern system. In modern system, they are usually going for IVF, IUI, and all those treatments where the treatment is much costlier. So let's go to our topic. PowerPoint is not moving. Dr. Karthik, some issue with PowerPoint, I guess. Okay. So our topic is an evidence-based report on treatment of infertility with procedures and investigations. So coming to the introduction, as you all know, infertility means the inability of the couple to achieve conception after 1 year of unprotected coitus. So when we take the statistics nowadays, we can see almost 50% of the couples globally, amounting to 48.5 million couples, are suffering from infertility. 2 in every 10 couples in the developed countries are suffering from infertility problems. So nowadays, when we take in India itself, 1 in 10, when we take the statistics, are suffering from infertility. There are lots of causes actually tending to infertility. We will discuss one by one. Now, let us see one more thing is that the treatment cost. So when we think about the treatment cost, nearly 30 lakhs of rupees are being spent in an infertility hospital by an average amount by a couple in a month. They'll be going for IVF treatment. Againly, as a as soon as the cycle comes, they keeps on spending like 5 lakhs again to 10 lakhs. So then, like that, it goes nearly to 30 lakhs. So why should they depend on such a costlier treatment? That is our question. So when we go for estimating what all are the problems of infertility, we can see are the only the females are causing infertility? Are only they are the sufferers? Is that a wide question asked by many common people? No, they are not actually. They are not only the problem makers, or they are not only the persons who suffer from infertility. Male and female both have equally same issues along with them. So what we are discussing here is that what all causes a problem for both female and male infertility factors. So coming to the female infertility factors, you can see like the ovulatory dysfunction problems are the most common one. Coming to the second one is the diminishing ovulatory reserve, and the third is the tubal disorders. So, in a common words, if we speak, we can see like endometriosis and all comes nearly to a 10% area. But nowadays, in our clinic, we commonly see like endometriosis is climbing upwards. Now, if you take in a class of 50 girls or 50 girls in the statistics recently conducted by the Indian government, we can see nearly 25 to 30 people are having mild PCOD symptoms. So what we have to do is that how to overcome these problems. That is what we are discussing today. So when we go for even in male infertility problems also, they have the same suffering. Like most problems is for attending for like sperm issues, mainly the sperm disorders. And when coming to the second, we can see mostly like to the varicose issues. Then again, lower, we will have small other issues along with it, leading to infertility. There are the obstructions of seminal vesicles that we can see. Now, now when we go for the investigations, what all investigations are we doing in an infertility uh, manner? Common thing what we do is that the normal blood review. Usually when we go for a to a hospital, they usually do the blood routines. They check for any other associated complaints along with it. Many of them tend to have associated hypercholesteremia or diabetes mellitus along with them. So when we compare both male and female matters, in female, what is the additional things is coming in related to investigations we'll be discussing today. Also in male pattern also. In male, what we always misses is the using Doppler in scrotum. So scrotal Doppler should be done in almost to rule out varicocele problems and associated other obstructions. That is a main important thing what we have to do along with the sperm analysis. Sperm analysis we will routinely doing along with other blood routines. But along with that, we should always never miss like we should never miss going for a scrotal Doppler. Is everyone able to see the PowerPoint? Is the PowerPoint becoming a little bit slow? Dr. Karthik, can you hear me? Is the PowerPoint legible to everyone? I can continue, right? Okay, fine. When we come for modern advanced investigations in leading to male related disorders, we can see like mostly like sperm disorders. Dr. Karthik is online.
Yes, I
Can you
am.
see? Can you
Yeah.
see? There's some issue with the PowerPoint, right? Can you hear? Can you
No,
see the
no,
PowerPoint?
it's not, but the sound is getting cut every now and then.
Okay.
So maybe if you come nearer to the mic, it'll be a little clear. Yeah, that'll be better, I think.
Now can you hear it?
Yeah, this is much better.
Okay, fine. But what about the PowerPoint? Is the PowerPoint getting slower?
Yeah, pipe. That's all right. There's no problem with the PowerPoint.
Now it's the ninth slide, right? You can see, right?
Yes, advanced investigation in mail.
Yeah.
Yeah,
Oh,
yeah.
it's not showing that
It's the ninth one. It's the ninth.
ninth one. Okay.
Yeah,
Anyway, no problem. We need not see the PowerPoint also. We can continue. Yeah, I will
no
go
problem.
forward. Okay. Main thing is that when we go for advanced investigation methods in mail, what we all need to do. So, like I said earlier, now in this PowerPoint, you can see like sperm analysis is the most important method which is being usually done by everyone, even modern system, the us, and in the Ayush system. Firstly, like in our homeopathic pattern, we are telling we take the history and the detailed analysis of the case. Then, secondly, what all we need to see in semen analysis. One is the ejaculate volume, then pH, sperm concentration, and the amount or the total sperm number, then the motility. Motility is one of the most important factors in male infertility problems. What we have to see because for this progression of the sperms are a wonderful and what we have to see in investigations how much is the forward progression or sluggishly motile or any other motility problems is that we have to analyze. That is one of the main techniques we have to see while we give a remedy. Okay. Then when we come to additional analysis methods, we can see like post-ejaculatory urine analysis and hormone analysis like FSH, LH, prolactin. All those methods are very commonly related to it. So next is the testicular biopsy or the exploration. That comes when we go for anything like we suspect any CA or anything else is there. The genetic screening is almost being done in all patterns. We also should do these things if we doubt any pathology related with it. So one more thing, what I am again adding to it, it may not be written here. It was there in the before slide. Is the scrotal Doppler. Scrotal Doppler is very important. We should never miss it because nowadays patients come with varicocele problems and they will not be knowing whether they are having a varicocele issue or not. Later they will be coming to know. That time it will be too much far and we cannot be able to treat also. Okay. So we have to see each and every possibility to diagnose what is the problem. Then only we should treat. We should not just treat the seeing he is having some infertility problem. Usually they will be telling like female is having. So they will not be so much cooperative. So what we have to do is that when we take the case of the female, we should always take the case of the male also. So we can tell like we need to get more additional details of the female. So we can give both people a small counseling and we can give the medicine also. And we need to always do this rotor Doppler because recently in a study it was told that out of the 20 people who in that study was conducted, nearly 10 people showed mild varicocele issues. So we should never forget it. Now, coming to the advanced test. Nowadays, when we do a sperm analysis, we will come to we'll be seeing mostly this fructose test written in the lower of the sperm analysis, or we can again write it for fructose test. When we go for an IVF or not IVF for infertility or fertility centers, we can see like they will be routinely doing this fructose test. So they are far, we need not think like they are far ahead of us. No, they are routinely doing to find out what is the cause. See, we also need to see, we should never miss when the fructose is written, we should
I think we just lost. He just lost connection.
Is the
Dr.
anti?
Akhil, we have lost video.
Can you see me? Hello.
Yeah, yeah. Now we can.
There is some problem coming in between, I guess.
Okay, now it's clear, doctor. Now your voice is very clear, and your video is also clear.
Video is clear. Hello.
Yes. Video is clear.
Okay, fine. So,
Your voice is also clear now.
okay, but for me, it's showing like lost connection.
Oh no. Now it's all right, doctor. You can go ahead.
Okay, actually, I need not focus on this PowerPoint. Everyone can focus what I'm telling. That will be more easy because when we
I'll
are
change it for you. I'll
okay,
keep
fine.
changing the slides. Not to
Fine,
worry.
thank you very much. So what we are going in the next slide is about the anti-sperm antibody. So anti-sperm antibody is another most important test which we need to analyze. And one more thing about fructose test is that fructose test, when it's a positive fructose test, it suggests that the patient is normal. But in a negative fructose test, it suggests there is azoospermia or obstruction of a seminal vesicle. So that we need to always be cautious when they are written in positive or negative. So we should never, if suppose in the fructose test it's written negative, we should never neglect it. Okay, that is one major important thing. And when coming to the next important is the anti-sperm antibody. In anti-sperm antibody, most of the people neglect doing anti-sperm antibody in an infertility patients. But in anti-sperm antibody, what we can see is that in a men, if any infection is there in a prostate or an injury is there in the testicles, so we will not be suspecting whether that patient is having those things. This can happen after a testicular surgery like a vasectomy, anything like that. So anti-sperm antibody can show us like there is a problem in this patient. Okay, so we can see in men also, in female also, both anti-sperm antibody needs to be seen. So coming to the next slide, it's about the homeopathic treatment. See, for all of us, we will be focusing more on homeopathic methods. But let me tell, homeopathic treatment is our major part. I accept. But before that, we have to diagnose, or we have to see what is the problem in the patient. Then only we can give a suitable remedy. So coming to the homeopathic treatment part, most of the people in female infertilities, they tell about azoospermia. In azoospermia, we can see majorly given, most commonly given medicines are Damiana tincture. Damiana is always given for when the patient suggests that there is some extreme sexual desire is decreased. Okay, along with that, they'll be having azoospermia problems also. Along with that, chininum sulf is given when there is an oligospermia and there is a destruction, or along with it he will be having some varicocele problems or an obstruction is there. So my routine prescription in azoospermia is that Damiana tincture I always give along with chininum sulf 30 TDS. That is my always given prescription. Now coming to the tribulus. Tribulus is a wonderful remedy if you give for motility problems. If you are suspecting in a patient having motility issues, even he's having lots of problem, even in allopathic part, they will be giving medicine. But this motility may not be improving. Some cases it improves, but some cases it won't be improving. For in our contest, if you give tribulus, it will give very good result. Only thing is that we have to take the case properly, and after you give a remedy, along with that you give the tribulus tincture. Tribulus will surely nourish the sperm motility. When coming to the premature ejaculation, that is another important thing we nowadays we see in youngsters. Like selenium 30 is the most commonly given prescriptions among us. Like selenium 30 is given TDS along with graphite tandem. So coming to our one of the protocol recently, we have seen like when there is a increased sexual desire and there is also a premature ejaculation, they are not able for coitions. We tendence to give in those people titanium 1M. Titanium 1M along with selenium 30 gives very good result. For them, they usually comes and tell within 2 weeks the improvement we can see. Okay. Only thing is that after you give a medicine, don't just hurry. Okay. Even in 2 weeks, if they are telling no improvement, means don't jump and change medicine. Wait for 1 month at least. Then you see what is the problem in your prescription. Okay. Now coming to the next part is a blood and pus in semen. That is another important thing we can see while we do a semen analysis. When those major remedies are like Cupram As 30 and Medorinum 10M. Medorinum 10M is a wonderful block removal medicine also. Okay, if you suspect a blood increase in semen, you can give Medorinum 10M along with selenium. It will surely give a very good result. If you see increased amount of pus cell in semen, you can give Cupram As 30 TDS. That will give very good result. Okay, phosphoric acid tincture is always given in people with along with diabetes. Patients show a severe weakness along with diabetic problems associated with infertility. Okay, balanitis, as you all know, it's an inflammation of the glans penis. So what we have to do is that in these patients, they'll be always tending about pain. So what we can do is that routine prescription is Lycopodium 200 or Melxol and Asal. These three medicines are the first grade medicines. I usually get 80% of the result with Lycopodium 200. Okay. When coming to the erection dysfunction issues, what you have to do is that you have to take the case properly. You should see what is the main cause for this erection dysfunction. Okay. Still, some of the major medicines which we usually give is ammonium carb 30, Agnus castris is commonly prescribed by everyone, fluoric acid 30, and graphitis 10M. I have got 2 patients treated with graphitis 10M along with Agnus castris 30, given a complete cure for that patient. Okay. Now, when coming to the varicocele issues, like I was always telling about scrotal Doppler. When you do a scrotal Doppler, we will be able to see there is a varicocele issue. So from grade 1, we can see. So when it comes to a grade 2, what is the problem is that when we prescribe one medicine and we wait, we should see the pathology. Pathologically, we should give a medicine that we can show a very good improvement. Okay, what you have to do is that you can give Arnica 1M followed by Hammermellis 30. That will give a very good result in grade 1. Then when we go to grade 2, grade 3 and all, major thing is that you have to see whether there is a severe obstruction. If there is a severe obstruction is there, or a major varicocele has gone to a major extent, then it's better referring, because you have tried all your remedies and you are not getting a result, means it's better for you to refer. Okay, we should never be down to refer the patient, because we should never feel like that. That is a I have got a patient like recently while varicocele issue was there, and after giving medicine he improved, but it was not getting successful totally. So I referred to one of the major urologists here, and he referred to a fertility center, and that doctor has written thank you for the referral. And that patient recently came and met me telling that he's very happy that his complaints have gone to normal. Okay, then telling about Formica rufa 3x, that is another specific remedy for varicocele that you can think of. So whenever we speak about these things, we should always speak with results. If we don't speak with results, no one will recognize us. So let me tell about one of my case. So in this case, actually, this patient was a village officer, and he was always telling about that he's having severe weakness, and his sperm count is always low, and his liquefaction time is 2 hours. That is a major thing in this case, actually. He has taken many medicines and it was not coming down. So he has come into homeopathy. What we need to do? So this case, you can see clearly like the liquefaction time showing like 2 hours, and also there is also problems in the motility. So how we can improve this case? This case, the major prescription I have given was nothing but civilinum. Because there is a severe destruction is happening, I have prescribed civilinum. And this patient also had a diabetes along with him. So civilinum has beautifully given us a result within 8 months of homeopathic treatment. The full count has also become normal, and you can see that liquefaction time within normal. That is a improvement we can see with our homeopathic medicines. If you give a correct medicine, you can surely give the result. Okay, and that patient and both wife was my patient, and she recently delivered last month. Okay, now coming to the advanced investigation in female. So when we go to advanced investigation in females, what we need to do is that regular things we can formally discuss that everyone knows. Like generally we do blood, everything. We see the for male patients semen analysis also we see. Then test for ovulations we see. Any tubal problem is there we see. Then hormonal analysis we do. So let me explain about one of the most important thing we see now in India, like the ovarian reserve. See, ovarian reserve is constituted by the size of the ovarian follicles and the quality of the oocytes. We should be very much careful seeing this, because this is very important part of our topic. Ovarian reserve actually decreases with increasing age, resulting in the decreases of the woman's productive function. That, as everyone knows, because usually ovarian reserve are not even considered. They just see that last diagnosis and we treat. We need to see the ovary size, ovary volume, and whether how is the follicle, whether this is matured, or those things we need to be very carefully assessing. Then only we can prescribe a remedy. Okay, now coming to the next part, like the ovarian reserve assessment. So when we go for an ovarian reserve assessment, what we have to do is like we have to see more advanced investigations, like advanced investigations at what all we can do for getting this ovarian reserve. Anti-Mullerian hormone is the major one when we go for an advanced investigation. That will come to next slide. Other things like follicle FSH, LH, estrogen, androgen, follicle count and all are usually done. This last one, like ovarian volume assessment, we can see in when you take an USG, we can see in the side written like volume of the ovary. How much is the volume? That is very important, because we can prescribe based on that also in some cases. Okay, that I'll explain when one more case will be coming. Okay, and one more thing I want to say is that in follicle FSH and LH, when you test, you have to see in the third day of the cycle or the second day. You should not go above third day. then you will not get a correct result also. Okay. So when we go to the other important one, advanced investigation we rarely do, and one of the most important things we should never miss is the anti-Mullerian hormone. See, some patients come to us with normal reports. They come to us with USG, everything, and it's everything is normal. And we regularly they'll be having like blood routines, CT scans, MRI, everything they'll be doing, and everything will be normal. But there are some factors we have to check for whether the how's the problem, what is the real problem in the patient. For analyzing that is the anti-Mullerian hormone. This anti-Mullerian hormone is really a wonderful investigation where we can come to an analysis whether the patient is within the ovarian, it's a ovarian reserve problem is there or not. So anti-Mullerian hormone is one potential test for ovarian reserve, as you all know. So when the anti-Mullerian hormone goes above very much high, that is above 10 and 14, in this chart is given 3, it's like it's showing like abnormals. Okay, but I'm telling above 14 and all, you can surely tell it's a PCOD problem is there, and it is obstinate problem. Okay, according to the chart and the WHO telling is that normal range is within 1. You shouldn't be get within 1 is okay, normal. 1 to 3 is normal. Lower normal range is 0.7 to 0.9. Till 0.9, okay, but below that is very much abnormal. Even when we tell to modern science, they what they do is that they just refer the patient, or they discourage the patient like 0.03 or 0.01. Now nothing we can do in this case, they just tell like that. So the patient totally they get disappointed. We should never do like that. We should always do this test, and we should give encouragement for them that with our medicine we can raise that, because only with our medicines the AMH tend to rise in almost most of the cases. 80% of the cases we get a very good result. So let me explain one of my recent cases with low AMH. This patient, actually you can see the age, it's really 37 years, and she was having a diminished ovarian reserve that you can know from this slide. You can see that anti-Mullerian hormone showing 0.32. This modern system, they have already done with this patient with almost all techniques. She has done IUI, IVF, everything, and at last that gynecologist told, see, your anti-Mullerian hormone is very low and we cannot do anything. Now if you do again IVF also, just money waste. She has already spent 20 lakhs. That time she's telling like, we cannot do anything. So she became very disappointed, and I got through case through one of my friend. I did this online. She was from Alleppey actually. So while taking the case, I came to know that she's having repeatedly abortions in the past. She had actually 2 abortions in the past, then she have not conceived till now. So there is a repeated destruction is happening on in her, and in her family history there was lots of hypertension, stroke, and also repeatedly there. So for us, we got a clue. There is a syphilitic tendency is seen prominently in that patient. So we can give a major syphilitic tendency related medicine. So I have prescribed nothing but syphilinum. Syphilinum 10 was given, and you can see after 6 months of treatment, 0.01 came to 3.01, and this patient conceived after 2 months. See, what is the beauty of this case is that they comes to tell us that first when they come to us, they will not be having any belief, but after we give the medicine and when the rapid change comes over, you can see that the patient will never leave homeopathy, and they will keep on referring patients to you. So we should be very much alert in case of like AMH cases. Okay, now coming to the some of the major normal values of our hormones is that FSH is like within 4.5 to 21.5. So below 21 is indicated as a lower volume. Like estradiol is 15 to 350 picograms, and inhibin is a level above 45 is considered as normal. So below we can see a declining ovarian function. Antral follicular count is another important thing that you can see through TVS. You should one more thing I want to add to is that when you do an USG, you never tell the patient to do only TAs. You should always tell transvaginal sonography also, you should insist. Then only we will get a correct assessment of the problem of the patient. Okay. So in antral follicular count on transvaginal ultrasound, the presence of 4 to 10 antral follicles measuring between 2 and 10 millimeter in diameter, we can see. Okay. Now, coming to the next part of assessment of fallopian tube patency. See, this is another important part. First, we were discussing about ovarian reserve problems. Now we come to fallopian tube problems. See, fallopian tube issues are another important factors where modern system doesn't have much scope, while we are having a wonderful scope. Like Thiocyanum 3x and Medorinum 10M are the absolutely miraculous remedies. They give a wonderful result for us. Okay. Actually, if anyone asks you, is that a miracle or is just water? You just tell homeopathy is beyond science. It's not just science, it's beyond science. So we can do much better. We know how our remedies act. Okay. So in this assessment of fallopian tube patency, one more thing what you have to see is that the chlamydia antibody testing. This test is actually very rare. They never do. This I came to know from a gynecologist while she was telling about the importance of this test. Like nothing else was there for that patient, but she was having that tubal disease. She found out from chlamydia antibody testing. It is not much expensive test also. So those cases we can again prescribe Medorinum. Medorinum is a wonderful remedy for fallopian tube. And Thiocyanum, when there is a blockage, Thiocyanum 3x TDS, you can give repeatedly with your selected remedy. It will give a very good result. Okay. Now coming to the next part is the cervical factors. See, most of the people will have a cervicitis or a chronic cervicitis along with like PCOD problems and all. So what we have to do is that we have to find what all is there any problems happening for this cervical factor issues. Like estrogen always stimulates the cervical mucus production. Okay, so when it goes above, the mucus becomes more abundant and watery. So the sperm will not be able to go through it, and there will be more issues. Like progesterone inhibits the cervical mucus production and renders it opaque and impenetrable. So again, it causes a problem. So these things which we have to be very much careful, and we should be knowing about these things. About this, I want to tell about the test is the post-coital test. This is most frequently utilized to assess the advocacy of the cervical mucus and its interaction with the sperm. So we'll be coming to know whether the sperm is having any problem or not after it goes inside. So another important test which we have to do is the torch screening. So in pregnancy, most of the people when they come with pregnancy, they'll be complaining like again in the third month abortions, fourth month abortion and all. What we have to do is the torch screening. This torch means Toxoplasmosis gondii, other infections, rubella, cytomegalovirus virus, and HSV. This constitutes the torch test. So why do we do the torch test? This torch test is done mainly for screening whether there is a problem with the current infection or there was any past infection in the patient. This will help us surely to prescribe our medicine. So this is one protocol, this torch protocol developed by Dr. S.T. Biju. We have given this in many patients and we have got an excellent result with it. Like if the toxoplasma is showing positive nature, you can give tuberculinum monthly 1 dose along with Toxoplasma gondii 30 BD. Okay, if the rubella is positive, you can give Natramute 200 or Helleborus 30 BD and Uncaryotoxin tincture 10 drops TDS. And in cytomegalovirus virus is positive, close your eyes and prescribe Syphilinum 10. It's a wonderful remedy. When we see herpes simplex virus is positive, you can give Vaccinum 200 2 dose once in a week. See, we can see one case related with torch. See, this case I got it in the third month. Actually, patient came to me in the third month. This patient had three abortions, and the patient already had 2 children. And in the 2 children, first child was having meningomyosile, was a problem with the spina bifida problems. Second child was having autism problem. So they wanted a normal child. So they were again trying, and then 2 repeated abortions also happened. So this is a major hospital in Kerala, and the radiologist has clearly mentioned in the lower part that they have counseled the patient and told for abortion, because they cannot continue this, because the anterior nuchal line seems to be prominent and there is a tendency for a genetic problem. So what they have done is that they told the patient again, after next ultrasonography also, they have again repeatedly told, you go for abortion, we cannot wait more. But the patient was stubborn. Okay, let him have again genetic problem, no problem. But patient had a faith in homeopathy. They told, like, we will try this time homeopathy, let whatever happen, no problem, doctor, just treat me. So what I have done is that I was suspecting there was some problem with the patient. Other all reports appears to be normal. So what I have done was that when I took the history, there was also a diabetic history within the family, and she was also having diabetic. It was in the moderate range. It was crossing like 150, and patient, they have already given the diabetic drugs also, and they have not told the patient first. Then they told, like, now it's come to a glycemic control, no need of worry. So I have taken that history also in my mind, and I have referred the case for torch screening. So when the torch screening came, this report clearly shows there was a past infection. There was a past infection of rubella and cytomegalovirus in this patient. So what I have done is that I gave, considering this, syphilinum, because cytomegalovirus was more issues, and her, considering her past infections and diabetic problems, the most important medicine to be given is syphilinum 10M. So I gave syphilinum 10M 1 dose along with that DNA 30. DNA is almost being given in genetic issues during pregnancy. If we suspect any genetic issues, we can give DNA 30 along with syphilinum 10M 1 dose. So I gave this medicine and I told the patient, wait. And that patient was consoling me, telling that, don't worry, doctor, no problem. We will wait how much time also. If she delivers the child having genetic issue also, they are not having any problem. So we should have faith in our systems. So I told her, don't worry, we will see to it. Then after prescribing the syphilinum 10M along with DNA 30 BD, I have prescribed till her delivery. DNA 30 was repeated till her delivery. So after giving this homeopathic medicines, in this report, now this report is showing, like, last scan was showing a single viable intrauterine fetus in with cephalic presentation, and they were telling now it's a normal delivery is possible. At the last moment, allopathic side or the modern medicine side is telling now a normal delivery is possible and no problem is there for the child. They don't know that we have given the medicine. So, but the patient party is very happy because they never expected this will come. And on 9/7/2019, she gave a birth to a healthy baby boy. And they came to us, and even they referred a lot of cases seeing this torch problems. So let me go to the next slide. See, this is intrauterine immunization. See, this is one of the super protocol developed by Dr. S.G. Biju, where we can use in the pregnancy period. See, the concept of this is from syphilitic medicines to soric medicines. You can see the transition. So we will get a healthy baby. You can see in the first month you can prescribe syphilinum 10M, and the 8th week you should prescribe carcinosin 200. On the 12th week, tuberculinum 10M. 16th week, medorinum 10M. 20th week, sulfur 1M. 24th week, sorinum 200. See, this much part is the most important part. So after we give these much medicines during this time, we can tell we will get a healthy baby. This is like an intrauterine immunization. I have tried in many patients and I've got very good result thanks to Dr. S.G. Biju. So now we go to one of the major and the most important diseases we see in youngsters and in the people nowadays who come to us with infertility, is the polycystic ovarian disease. Everyone knows and everyone is treating lots of cases and everyone has got a very good result. I would like to share to you some of my observations. and some of my practical experience on how you can treat the PCOD conditions. See, when you can take the case and you can prescribe a medicine, no problem. That is the best part. And if you get a clear cut remedy, means that is enough. But in some cases, we will not be getting a clear cut remedy. So in that cases, we have to see this size may be more. So if it is a right sided cyst only is there, like right ovarian cyst is there for the patient, you can prescribe epis 30 tds along with your corresponding remedy what you are prescribing. So a drug level, it gives a very good action. This epis 30 can be given in both, like right ovary and left ovary. This cyst is appear also for PCOD. You can give epis 30 tds along with your selected remedy. And silesia is another close running remedy. When you see only right ovarian cyst is there for the patient, and patient is having an amenorrhea. Okay, when you see that UST finding, you will get a bigger cyst in right side. Then you can do is that along with your selected remedy, you can give silesia 6x TDS. It will give very good result. Now, Tuja 1M is indicated very well in case of left ovarian cyst. Only left ovarian cyst is there, means you can give Tuja 1M once in 2 weeks. So after 3 months, 90 days, you can repeat the scan. Okay. See, I am not telling that it's a hard and fast rule. You should give these medicines. These are some tips or some from my experiences. Like after giving this, I have got result. Okay. Now, palladium 30 is another important medicine you can think when there is right ovarian cyst with bigger and it's not coming down. It's an obstinate right ovarian cyst. Whatever medicines you have given, we are not getting result. We can give palladium 30 TDS along with the selected remedy. Now, coming to the persistent amenorrhea part, see, most of the polycystic ovarian conditions, you will be seeing amenorrhea. Amenorrhea may be 6 months or 1 year. What we can do in case of persistent amenorrhea? So, patient want a quick satisfaction. For that, what you can do is that you can give cifolinum 10 one dose plus pituitrin 30 TDS for 20 days. So, in that pattern, you will get uh, menses, sure, but that is just for the patient's consoling part. Then you have to get the correct medicine and you can prescribe. Okay. When coming to the menorrhagia problems in polycystic ovarian research, now in the age from 15 to 20, we regularly see menorrhagia problems. So menorrhagia problems, what we will be doing, most of the people tend to refer the patient, let them take some hormonal drugs and all. So what we can do is that you do, most of the people will be controlling. Just I'm telling my experience is you can give arnica 1m 3 dose plus crotalus horridus 30 2 hourly. It's a very effective and it will control. Okay, you can try it and you can tell me. Okay, then this, in case of dysmenorrhea problems, you can give Macforce 1m, that is a routine prescription. Then another thing, two tinctures what you can think is a Aletris farinosa tincture and Damiana tincture. Damiana is a wonderful tonic. Like Aletris farinosa is always given in dysmenorrhea along with PCOD. In those conditions, Aletris farinosa gives very good result. Okay. Now, in case of hirsutism is excess in the PCOD cases. As we all know, male hormones will be higher in case of PCOD problems, and also there will be cycle will be irregular. And another important thing we can see is a hirsutism. This hirsutism, how to control it? You will be giving a remedy, correct? And that patient may be improving, but the hirsutism is more. You will be feeling patient will be coming and complaining. Still, the hirsutism is more. What you can do? This is a tip. You can try this. Calcarea 10m 2 dose plus Asteria rubens 30 TDS. It's very effective and you can try it. That hirsutism will come down. Okay. Now just we'll go for one case. This is one case referred to me from one of the gynecologists. Actually, I think like she was just testing us. Like she told the patient you can try homeopathy, and she just told the patient you go to a homeopath and you take medicine. If not improving, means come to us. So like that. So the patient came. In the patient, what she was telling that she was having only 21 years, and she was already married. She was having lots of problems means the familial issues, stress and all those issues, and her cyst size was bigger. So she was not actually, she was just trying whether homeopathy will work or not. Because the gynecologist told an opinion, she just came to us. So what we did is that we gave the corresponding medicine for her. Actually, it was coming as lacuses, because her observation was that, from my part, was that she was keeping on putting her tongue outside and inside, like the snake. Okay. Along with that, she keeps on changing the topic again and again. She's very much talkative. Talkative means she will never stop. She comes and sit in the clinic. She makes at least 45 minutes. She want to talk. Then only she will go out. Otherwise, she will make faces. Okay. So we got a correct remedy actually there only. But major thing is that we want to get a result in this case. I got this lacusis, this in the third follow up actually. At that time only I came to know that she is frequently having all these problems. From observations, I got lacusis. So in my first prescription, what I did was patient should have some improvement, right? I gave Epis 30 TDS. Along with that, then in my third follow up, I gave lacusis. In after, so next slide we can see after 6 months of treatment, we can see one side cyst has completely gone. Now only in left ovary the cyst is there. Okay. So what I did was that I raised the potency from lacusis 1 m to 10 m. 10 m one dose. Again, I repeated Epis 30. So after 8 months of homeopathic treatment, we got the pregnancy case positive. She delivered a healthy baby 3 days back. It's very coincidence that the 21st she has delivered. So um, uh, uh, one more thing is that major thing about PCOD is that if you get a left ovarian cyst and if it is still obstinate and you give lots of medicine and it's not working, what you have to do is that you give Medorinum 10 m. Medorinum 10 m you should give as a block removal. So after giving Medorinum 10 m, then you can come to the remedy which you feel. Okay, Medorinum 10 m will remove the blockage. Okay, so that is one more tip what I want to share. Now, going to the next important thing. According to the statistics, it tells that only 10% of the people suffer with endometriosis. But nowadays, if you see, most of the people complain and ask to us about the doubts about endometriosis. You take any magazine nowadays, people write articles about endometriosis, about diet about endometriosis, many things. So, what is the real problem in endometriosis is that is the severe pain, crampy pain that the patient cannot even rise up. Patient cannot even take another dose of medicine. She'll be lying on bed. She'll be screaming. Lots of problems. She'll be in utmost anger. Okay. The main problem is because another tissue is formed outside the uterine cavity, like the endometrium. So this endometriosis issue we need to tackle very cleverly. Actually, there will be adhesion, scar formation, and all in endometriosis that you all know. So what you have to do is that you have to first take the case properly. Then only you should prescribe in case of endometriosis. Simply don't jump and prescribe thiocyanum or one medicine, because first we have to control. What you have to keep in mind is the pain. When you do a pain management, surely you can assure the patient that we can do miracles in endometriosis. So let me tell about one of my cases. See, this case came to me with severe pain. Actually, she had severe pain. When we checked, it was already endometriotic problem was there. There were septations and all problems, and she was also having a small fibroid. So she was actually from Malappuram, and she referred to me from one of my senior through online. So what I did was that I told her to do a scan and come. When she went for the scan, that gynecologist told like, this is very difficult. You do one thing, you try IVF. So she is telling to the patient like, you do IVF. This is not possible. So patient was very much sad and she was crying and all, totally upset. She was lots of stress was there with her. I took the case, and after I was taking the case, I came to know that she was going to a staphysagria type. Lots of suppressed emotion was there. So what I did was that I usually gave staphysagria. Along with that, what I did was that I gave thiocyanamide 3x. See, thiocyanamide 3x was given along with Staphylococcus aureus so that can see that the cyst also the septations will reduce. Thiocyanamide is a wonderful remedy for removing the adhesions and the scar formations. Okay, so what? One more thing in related to endometriosis, what you have to do is that when you do a USG scan, always tell the patient to do a transvaginal scan also. They will otherwise come with only TAS. That time you will sometimes some cases shows like it's normal. Okay, some endometriosis things we'll get only through transvaginal sonography. The exact size also we will come to know, and the adhesions we can properly visualize. And some people through laparoscopically also it's done. Okay, so in this case, what I did was I gave Staphylococcus aureus first one dose, but after giving Staphylococcus aureus, she got severe pain. So what we have to do? She cannot even get up. So what I have to do is that I have to manage her pain. So our obstacle there is that unless you manage the pain, the patient will go from you. So what I did was I have to somehow stop the pain. I prescribed nothing but Abroma Radix. Abroma Radix tincture was given 10 drops 2 hourly. 2 hourly Abroma Radix tincture was given, and after 4 hours with Abroma Radix tincture, or 4 times with Abroma Radix tincture, that means 8 hours. We got a complete relief. She got a complete relief, and she slept. After 2 days of severe pain, she slept on the third day. That Abroma Radix was given to her then SOS for any severe pain. Dear friends, after giving the Abroma Radix, the most important thing I saw in this endometriosis case is that she never got that crampy pain. Even if the pain starts also, if it didn't go to a severe extreme. If the pain increases, she takes Abroma Radix, that pain goes down. So that much quality we have in our drugs. Okay, so I prescribe the medicine, Staphylococcus aureus and thiocyanamide 3x after the pain reduced. After 1 month of treatment itself, the size has reduced its size. The cyst has reduced its size. That's a typing mistake. So you can see that scan report is telling that like the cyst has come to the half of the size. So this gynecologist told how it's possible that who treated and which system you went, and that patient was actually very happy because even her small fibroid was also disappeared with our medicine. And you can see that adherence also to the uterus. Now she did a TVS also. She told now it has size has completely come down. You will get a good result. You continue with this treatment, that gynecologist told after seeing that. So after 8 months of homeopathic treatment, we got the pregnancy became positive, and it's a very happy thing that endometriosis case. If you see properly and treat, we get very good result. I would like to share a major tip in endometriosis is like the pain management. See, like I told earlier, some of the leading drugs for pain management in endometriosis: Abroma Radix tincture, Colophylum tincture, and Viburnum opulus. Viburnum opulus you can give in people in 20 to 25 years. In that age period, they'll give very good result. Okay, a Colophylum is a routinely given medicine, and Abroma Radix ranks higher in case of endometrial pain subsiding. So one more thing is that if you get a correct remedy also, you think of these medicines when there is subsequent pain. So pain will come down and your medicine remedy also will work well. So this is what I have to I wanted to tell in terms of endometriosis. So dear friends, let me conclude. Homeopathy can offer the helping hand to the suffering by providing a cost-effective treatment. See, they are 30 lakhs and all they are giving to a fertility center. To for us homeopathic treatment, we have done just 2,000, 3,000 within that range. We have finished the cases in 3 months, 4 months, and all. We have finished it. So even if we take 10,000 also, we are sure that we can give a very good result. We need to do more research on the treatment of infertility with homeopathic medicines. Nowadays, government is funding very good money for homeopathic system for the for more research, doing more researches. Indian government also is funding. Now Kerala government is also funding. So we have to do more research so that we can show to the modern medicine that we can do very much wonders in infertility treatment. We need to use the most advanced investigation for the diagnosing of the problem. Dear friends, never ever keep quiet and wait for the other modern system medicines to come with the report. Like they will be writing AMS, then only we will be focusing on that. No, if we get the infertility patient first to us only, they came directly to homeopathy, then what you have to do is that you should see all the investigations one by one in that orderly manner. If you are not getting any cost, you can go for AMH. You can try. If they are getting recurrent abortions, problem is that you can check torch problems. So those things are there. Wide range of tests is there. Like fructose test, you have to see in males. Never miss it. So that will give a clear idea, and that will make us more confident in prescribing. Okay, we can provide a rapid and safe cure for the couples with infertility. We can give them a very happy life afterwards. Okay, always document the cases with reports of before and after treatment. My dear friends and doctors, never ever miss a document in these cases. Yeah, if even if a small they have come for a follow-up also, you take that with your camera, you just take a pic of that report and keep it with you. Then only we can use it for further presentations and more researches. Then only people will believe that you have treated. See, to me, when a patient comes, what I do is that what I have a case reports, I show to them with name and other things being hidden. I show it to them, so they get more confidence to us. So these things we have to keep it quiet, and we can do more research on this field. My dear friends, nothing is impossible. The word impossible itself says, I am possible. Keep always in that mind and do homeopathy. With homeopathy, we can do a very good treatment in infertility field. Thank you very much. You can feel now. You can message your doubts actually.
Yeah, participants, if you have any, you can start asking. If you have anything to ask, you can put it in the chat box and
You can actually repetition. Repetition.
azoospermia be helped with homeopathy?
Yeah, I have already talked with that azoospermia. You have to first, what you have to see is that what is the problem of azoospermia. We have to find out. See, you can do other than sperm analysis, you have to do a scrotal Doppler also, so that you can find what is the real problem causing to azoospermia. Azoospermia, a wonderful remedy you can give is cipilinum. You can start with the case with cipilinum. Accordingly, you will get a very good result. Then you can prescribe a remedy of your choice. Okay, repetition of the remedy. When should we take the USG for the cases of endometriosis? In endometriosis cases, what you have to do is that after you give a remedy, you have to wait at least till 90 days, because unless you
I think it got stuck. Doctor, your video and audio is stuck.
please tell again regarding IUI. Is syphilis Uh, uh, See, regarding IUI and IUF, see what you have to do is that after you do the treatment, you can do a treat after you do the treatment, and if you are not able to give a subsequent relief for the patient, or you have done the utmost capable things what you can do, and the patient has gone a rapid improvement have shown in some cases, and but still the PCOD has gone, but still the patient is not conceiving. In those cases, you can refer for an IVF or an IUI. So we will get a very good result because it's type of management. Okay, but in patients having PCOD and endometriosis, you have not treated the PCOD and endometriosis fully. If you refer also, there is no use. Okay, pain management in endometriosis. Please explain. See, I have already told pain management. What you have to do is that you can simply close your eyes. You give Abroma radix tincture. In any cases, generally you can give Abroma radix tincture. That you have to give 10 drops. That also you have to repeat in 2 hourly. If the pain is so severe, you have to give a 1 hourly also, because then only you will get a beautiful result. Okay, how to reduce testosterone levels in PCOD cases? See, in regarding testosterone levels in PCOD cases, what you have to do is that you can give Asteria rubens. I have already told Asteria rubens 30 TDS plus Medorinum 10. Give it and see. You will get very good result. Okay. Then intrauterine immunization. Immunization. See, uterine immunization is a protocol developed by Dr. S.T. Biju. He has a 30 years experience. From that, he has developed it, and he has passed that information to us. See, what we have done is that most of the cases, whatever cases I got in pregnancy time, I have given this medicine as an intrauterine immunization so that child will be a normal. Okay, and child will be will not be having any other issues going for any cesarean and all. We will be getting a normal healthy baby. Okay, that's it. Torch protocol. Can you please repeat the medicine? See, in torch, you can see in our PowerPoint. I would see Toxoplasma gondii, rubella. These are the main medicines in torch. So what you have to do is that in toxoplasma is positive means you have to give tuberculinum monthly 1 dose along with toxoplasma gondii 30 BD. That you have to repeat. Okay. If it is rubella is positive means natrium 200 you can give BD along with natrium 200 dose plus Helleborus 30 BD. Okay. If cytomegalovirus is positive, you can give Syphilinum 10 and wait. Okay, if it is HSV, herpes simplex virus, then vaccinum 200 2 dose once in a week you have to give. Okay, then you will get a very good result. So that is a torch remedy. Can you put the torch slide,
Yes,
doctor?
yes, I'll just get that.
May I ask you for that? How many months AMH have to repeat after treatment? AMH treatment after you give a medicine. See, I always tell you can start with Syphilinum because Syphilinum has got many results. Like even out of 20 cases of AMH which I have treated, almost 16 we have got result with Syphilinum. Syphilinum tenom, you can start with the treatment and you can check it after 120 days. 4 months is the correct time. After 120 days only you need to check it. So then we'll be coming to know whether that remedy what you are given is right or wrong. After Syphilinum tenom, you have to give a remedy. What do you think? Okay. So Syphilinum will just remove the obstruction and that destruction problems in the patient. I have a little more about medicine DNA. See, deoxyribonucleic acid, as you all know, see, this medicine is given routinely for curing the genetic issues, especially in pregnancy times. So, in pregnancy ladies, if they complain of any genetic problems, they suspect. Along with your remedy selection, you can give DNA. DNA is like a supplement. It will it will remove the problems causing to the child. So you can give TDS. DNA 30 should be given TDS from the month you start till the end. Till the lady delivers, you should give. Please describe miasmatic dosage and potency. See, miasmatic dosage mainly thing is that when you give cipilinum or medorinum and all things like cipilinum 10m is or medorinum 10m when you give, this is like a block removal. You need not frequently repeat. You can give one dose and you wait in those cases. Then you can give your subsequent remedy. After you give cipilinum, wait for 30 days. Then you can give a remedy. If there is, then you will get a good result. Then only you go for an USG. Okay. Role of this one. See, main
Electris
thing is
farinosa.
Aletris farinosa. See, Aletris farinosa is like a general tonic. Actually, in the case of young girls, like from 15 to 20, or it's mostly acting in 25 to 30 years and 15 to 20 years. So in those cases, they'll be severely telling about weakness after the menses time. They'll be severely telling about weakness. What you have to do is that you can give Aletris farinosa along with your selected remedies. Aletris farinosa will surely reduce the weakness and the problems associated. How I watch this video again? You will get the video again. Okay.
Yeah, we'll share the video. We'll share the video.
WBC in semen. See, WBC in semen, I told before, is Cupramaz. Cupramaz 30 TDS you need to give. Cupramaz 30 TDS you can give for the patient. Your WBC will come down.
There was one more, doctor. How do you balance androgen level in male?
For androgen problems, what you can do is that first you have to analyze which which uh, which is the main issue relating with that patient. Maybe some people will be having associated complaint with androgen insufficiencies. So in those cases, you can give pituitrin. Pituitrin is a very good drug in those cases. Pituitrin 30, you can give TDS. TDS, it will surely come down.
Doctor, from the Facebook live, there's a doctor who wants to know what is the medicine for oligosperm.
See, oligospermia, many medicines are there, but still, as the count reduces, you can suggest Tribulus is a very good medicine actually. Tribulus tincture. Tribulus is a very good medicine. Selenium corresponds. Selenium 3x is a very good medicine you can think of. See, one more thing I am again repeating is that if you get a proper remedy, if you get a correct remedy, if you feel that remedy is of your choice and it is correct, you need not go for anything else. You just give that remedy. But these things are for you can, if you get a blockage, these tips will help you. Okay, so you can, if you are getting a severe oligospermia problem and it's not getting control, means you can think of giving a miasmatic drug like cipilinum or medorinum 10m 1 dose. Along with that, Tribulus tincture you can give, and selenium 3x TDS.
There's another second infertility after taking the MTP kit. Which medicine should we give? Which we can think of.
MTP kit, secondary infertility, right?
Yeah, secondary infertility after taking MTP kit.
It's actually a difficult one. In those cases, I usually refer the case. I don't take that case because we will be we'll be getting this much opportunities in this much cases. In those conditions, if we treat and if anything happens, that will create a spoiler. So it's better that refer. I usually refer those cases. And if afterwards, if it's just secondary infertility, means we can treat, because usually some goes for another unwanted terminations, illegal things they do and come to us that we cannot promote. Okay, that will be a problem for us. Otherwise, means you can really, for secondary infertility, you can take the cause, find out the cause, you can give the medicine with the suitable investigations. Okay. Tuja is one Tuja you can give in 1M potency in those cases, because there will be a gap will be there in some cases and they are not conceiving, that worry will be there. So Tuja will help them.
Yeah, I think what to do with anti-sperm antibody.
See, anti-sperm antibody, that slide is there. Can you take that slide? I'll just share you that slide. It was there
This is
beginning.
in the
I'll
beginning, is it, doctor?
Yeah, in antisperm after fructose test. This antisperm antibody you can do in both men and women. Okay, this is done just to find whether there is a problem still is available in that men or the women. Because antisperm antibody, if it is positive, means you can treat in that manner. So what medicine you have to give is that in antisperm antibody, that's a good question actually. Antisperm antibody, if it is positive, means you can think of giving medorinum again. Medorinum 10m plus selenium 3x. After giving that, then you can go for your suitable remedy that will remove that blockage. Okay, that will help you for the future treatments. Besides tribulus, anything for motility. Besides tribulus, yeah, you can think of ustilago. Ustilago is another wonderful medicine remedy, drug level thing you can think of. How can hydrosalpinx? One superb remedy for hydrosalpinx you can think is that Epis 30 is a very good remedy, but you have to check it only after 120 days. Again, I tell you should wait for 120 days, then only you check it. You can give Epis 30 TDS along with, you can, if you want, you can give Ashoka tincture also. That will give you more result. Let me add one more thing because already that I missed. I think in PCOD cases, in age groups like from 12 to 18, in those age groups, and like a teenage group, you can give Ashoka tincture along with your selected remedies because Ashoka will prove as a tonic for them and will help them in PCOD cases. Okay. WBC in 7, I have already told, it's you can give Cupramas 30. Antisperm antibody, azoospermia. Yeah, I think that's
Yeah,
over.
thank you.
Hold on. PCOD medicine. I missed that slide. Can you just put that PCOD slide?
Yeah.
See, that PCOD is, see, I am telling you again, PCOD, that slide is from my experience, okay. What all I have done, see, how to reduce size, okay. If it's right side means you can, right side and left side, if it's obstinate means you can think of Epis. If it is only left side means you can think of Tuja. If it is only right side and ovarian cyst, you can think of Palladium. Okay, so that's the things you should think of. How to manage adenomyosis case, I would like to add to it. Adenomyosis case, along with your selected medicines, you have to tell them about management also. Okay, see, some people will have a strong addiction to coffee and all, coffee like chicken like things. So you have to reduce that carbohydrate level, fat level. Along with that, they should walk. You should advise them to walk. As soon as their pain subsides, you should suggest them for walking at least for 30 minutes. Okay, that, or do exercise correspondingly. Okay, you don't tell them in the next day only you jump to do 30 minutes. You advise them first, let them do 10 minutes, then increase 15, 20 like that to 30 minutes. Okay, if it's possible to do 45 minutes, this is well and good. Primary amenorrhea. See, doctor, primary amenorrhea, I have already told. If it is persisting for 6 months, close your eyes and give Cipelinum 10m one dose plus Pituitrin 30 TDS. 28 days is the time period. Within 20 days, usually you get result. Liquefaction time high like 2 hours. Yeah, liquefaction time when it is high nearly to 2 hours, what you should do is that first you have to find whether any other associated complaint is along with the infertility issue, any associated like hypercholesteremia or diabetes is there. If nothing is there, you again coming to the main drug level prescription, you can think of tribulus. Along with tribulus, you should give medorinum 10m. Medorinum 10m 2 dose you give, then you can give our tribulus tincture. Okay, if like diabetes or any other syphilitic tendency things are there, you can think of our syphilitic syphilinum. Syphilinum 10m you can give, followed by tribulus tincture. Tribulus tincture you have to repeat it. Okay, at least for a month you should repeat. 45 days is the time for checking the sperm analysis again. Okay, wait for 45 days, then only you check it. Tubal blockage. Yeah, tubal blockage. I have already told actually. Tubal blockage. You can think of giving thiocyanine 3x is a wonderful remedy. No doubt, it will give you very good result. Along with that, you can think of Tuja. Tuja 10M will help you in removing the blockage initially. Then thiocyanine 3x TDS you can give. Does it take to reduce it? That's a very good question and confusing question. But I should tell really, I have seen hirsutism changes within 40 days. Okay, within 40 days you will get changes. That's why I told you can give Asteria rubens. Okay, along with your corresponding remedy, it will be very good result you will get. You try it and tell me. Okay, Asteria rubens 30 TDS.
So I think with this, most of them have had their doubts cleared.
Yeah.
Well, once we finish this, we'll be sending a recording of this to all the people who have registered. Some of them may not have been able to see it live. They can always see it at a later time. I'd like to thank you, Dr. Akil. It was an exhaustive, it's a huge subject. And you've done this in 1 hour. Of course, you've just gone through everything.
Actually,
I'd like to thank you.
This is a like a capsule model. Okay,
Capsule, of course.
If you go in detail, means you can go many much like FSH, LH, and all. You can go in very much detail. Okay,
that's right.
This is a capsule method which we stress more on homeopathy. What all we can do with our homeopathy. Okay.
Definitely. So I want to thank you, and I want to thank Dr. Biju for the wonderful work he's doing at Sahya. And to end this, we'd all like to wish you again a happy birthday and happy engagement to you.
Thank you so much, Dr. Karthik, for inviting us, and also Dr. S.T. Biju sir for referring me to you. Thank you very much. Thank you very, very much.
Thank you.
I think I have, to my capability, I have given from my own experience, I have told everything. Okay. Thank you very much.
That's a wonderful presentation, Doctor. Wonderful presentation.
Thank you so much.
Thank you.